So that's a positive whiff test is indicative of bacterial vaginosis. Another one is that the vaginal pH is more than 4.5. More than 4.5. You also see clue cells on a wet mount preparation. Clue cells. Clue cells are basically vaginal epithelial cells that are covered with the bacteria. Vaginal epithelial cells covered with the bacteria. This is a picture I stole from the presentation. This is showing us the epithelial cells. It's a nice picture. The one that the difference between epithelial cell and a clue cell. Okay. So remember, bacterial vaginosis is the pathogenesis happens as a result of something that disrupts the natural balance of the vaginal flora. This is what's known as dysbiosis, which is a microbial imbalance. Okay, microbial imbalance. Now, clue cells, as we said, they are vaginal epithelial cells that are covered with the bacteria. Under a microscope, they appear fuzzy without sharp edges. As you can see that they're appearing fuzzy without sharp edges all over. If you read on your future exams on the NCLEX, the patient, the diagnostic tests, microscope showed clue cells, right away just choose bacterial vaginosis. That's it. This is only with bacterial vaginosis. Am I going fast or are we good? Go slower? Okay. Oh, I'm going too slow? Okay. All right. Okay. Diverticulitis. Diverticulitis. This is basically inflammation or infection of the colonic diverticula. Okay. Colonic diverticula. And diverticula are outpouchings. Outpouching in the colon that get infected, leading to diverticulitis. Which part of the colon, remember the colon is the large intestine, which part of the large intestine is most commonly implicated? It's going to be the sigmoid colon. The sigmoid colon. Remember, the sigmoid colon is on the left side, which is why patients almost always present with left lower quadrant pain. Left lower quadrant pain. Okay. What type of patients should you suspect diverticulitis? An older patient, especially an older patient who has a low fiber diet, an older patient with a low fiber diet, presenting with left lower quadrant pain, right away you should suspect diverticulitis. Okay, so the causes of diverticulitis. Okay, most commonly is going to be caused by normal colonic flora, which includes the Bacteroides fragilis and E. coli. Both of these bacteria are rod shaped. Both of them are gram negative. They are both mesophiles. Remember, mesophiles means that they like to grow most optimally in 37 degrees Celsius, which is our body temperature. Okay. The difference between these two bacteria is that E. coli is a facultative anaerobe, while Bacteroides is an obligate anaerobe. That's the difference. I'm gonna stop sharing my screen for 1 second because I want to pull something. Give me 1 second. Okay. The next one is UTI. UTIs. Okay. We're gonna start with uncomplicated UTI. Now, before I start talking about uncomplicated UTI, I first want to classify. I want to go over classification of urinary tract infections. Classification of urinary tract infections. Because there are several ways that we classify UTIs. Okay. One way to classify them is anatomically. And we have basically upper urinary tract infections and lower urinary tract infections. Upper urinary tract infections is basically any infection of the kidneys and the ureters. Any infection of the kidneys and the ureters. Pyelonephritis means infection of the kidney. That's an upper UTI. Lower urinary tract infection means